you or your loved one plan for long-term care? If your loved ones did not plan for long-term care, there are options on your state and your county that is available to you. Stay tuned. We're going to talk about it.
Welcome to Senior Care Made Simple, an ElderCare podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening. I am Andrea Albertini with Senior Care Made Simple podcast. And I am here today with my co-host, Doris Muscarella. Hello, Doris.
Hello, listeners. Hello, Andrea.
And thank you for all of our followers. Please continue to like and subscribe our episode as we continue to grow and provide some wonderful resource information to you guys. Today, we have an incredible guest, and her name is Sharonda McClendon. Sharonda, so tell us what you do.
My name is Sharonda McClendon with Three Angels Consulting. We're an ElderCare planning company. And what we do is we specialize in providing services as far as Medicaid planning for long-term care in a facility, as a skilled nursing facility, and also in the community with assisted living facilities or homebound clients. Most of our clients are more complex cases. Their assets or income is out of the range to be approved for Medicaid for the state of Florida. So what we do is we put a plan together for those individuals so that they can receive, qualify for the Medicaid, the long-term Medicaid in Florida.
I was reading your background and I'm very impressed. Mm-hmm. Can you give it to us in a nutshell? Because it's important.
Oh, yes, it is. 24 years of skilled nursing and rehabilitation. So like, for instance, the long-term care. I started out in the nursing homes as business office, the financial piece to the organization, then became a regional consultant, which would oversee the business office staff. After, going through that roller coaster in my life, but I took on and started Three Angels. It's an ElderCare planning company with my expertise and my knowledge that I've had throughout the years in skilled nursing. Starting with that, I worked with some good companies that taught me a lot. So it was best for me to go out on my own to see exactly how I can venture out to help in a different whole manner, because there's only a certain amount of things you can do when you're an employee at, in a skilled nursing facility or assisted living facility. But my background have a lot of knowledge I've gained throughout the years, just working along with them. And I'm not completely out of it because I do consult here and there for some nursing homes. And also when I'm in them all the time, as far as that's where I receive a lot of my clients from are those facilities. So I still have my hands in the pot, but not all the way as if I, had before.
I think that one of the things that I have seen, Sharonda, we are, for a lot of you who are listening to our podcast for the first time, we are in South Florida. We are actually in Palm Beach County. One of the things that has come up, that's why one of the reasons we wanted to have you in our podcast today is for a lot of people who has not planned for long-term care.
Exactly.
And, where financially, right? So, for you to explain what the options are, because we do get a lot of phone calls from people with very low income,
yes,
who has not planned for long-term care, who has no money to age in place the way they would like to, but there are some certain help from the counties and the state of Florida, or for the state of Florida, that would be able to provide some kind of care.
One great program that is in Florida is the waiver program. And it can start out at the home or in an assisted living facility. They've did a lot of changes with that because before we as providers like myself know if we put someone on that list to get those services, because those services will pay towards their stay in an assisted living facility or send in caregivers to the home. but that program is through Elder Affairs. Right now is how it works now is that they kind of score you between a 1 and a 5 on what your needs are. If that person did that phone interview with Elder Affairs and scored a 5 on that call that day, they're eligible right away for to apply for that long-term care. Years ago, we didn't know exactly what spot we were in, what number we were on as far as the next person in line for those benefits. But now they've made it a lot easier. Once you're on that call, you complete that call, they give you a score and they rank you. So it gives a person an opportunity to know exactly, yes, I'm up here, I'm soon. Those benefits should be coming to me as soon as possible. Now, once you score 5 the next week, so they send out a letter, and then you can go ahead and apply for those services. But my thing is, with me, is what I see a lot of times is that we're called in at the last moment where everything is in a crunch moment when we should be preparing for this a lot ahead of time, instead of when that person has gotten to the point where dementia probably has set in, or they're having falls and in and out of the hospital, going to skilled nursing facilities. The education before time is where it's needed in our community, because they don't get it. By the time they get to me, they're clueless. They have no clue of what's out there, what services there is, even in Florida, for their seniors. So just getting out here and actually promoting and giving them the information is very, very important in our neighborhoods, our churches, and things of that nature, because they're clueless by the time they get to the hospital and have to be transferred over to a rehab center. But like I said, the state of Florida does have a lot of things in place for our seniors to assist them with getting that help that they need for their long-term care.
So if I call you, you will provide those resources? Do I get a consultation? How does that work?
With us, we do a free consultation. I feel like information is free. I've actually spoke to some people, before in the past. If you choose to go somewhere else and my knowledge wasn't enough for you, information is free to me. So I give a free consultation with all my clients to go over it, things that they need. And that waiver program is just like a biggie for me. So even with that, I give them a consultation. Then I assist them with calling into the waiver, getting that appointment set up, and going over those questions that they're going to ask them and things of that nature. Because by the time they get to that call, they may be a little nervous. They want those benefits, really bad, and don't know how to go about it. So what I do is I actually assist them with, these are the things they're going to be asking you. So by the time they get on that call, they're very familiar with mom and dad and what is needed to get them the help they need.
I think that one of the things that you are talking about, and we see that all the time, where patients are in crisis, they're in a hospital now, they need to go in, they need private duty, yes. They need help at home. But the process of the Medicaid application and all the things that Sharonda is talking about is not in place because it takes time.
Yes.
So I feel that everyone that reaches 65 years should be able to contact her immediately to be able to apply for some of those things. So when that time comes, they already set.
For me, I'm speaking on my experience, sometimes those forms are really intimidating. So to have a resource like you to help me out with that's amazing. Yes. And I saw that you also have disability planning.
Yes. Yes.
Tell me a little bit more about that.
With disability, that's been a lot lately, is disability cases with people that are of a younger age that has not reached the 65 year of age for, their retirement stages. Disability is really a big thing that's going on right now with the younger population. It's really out, it's a lot as far as with the age group. So we are having to apply a lot more to disability for an individual. And that's the thing with the state of Florida is anyone that applies for the Medicaid long-term care in Florida, you have to have a disability application out there if you're not of retirement age. So that's one of the things that is required with the state of Florida to give you services under Medicaid is to have a disability application.
Can I ask you why the younger population?
There has been, and everyone is known with dementia is coming a lot younger these days. Just in general, with the lifestyle of the population, it's gotten a little different. But the ones that I've been seeing in the facilities have been younger, homeless, things of that nature that they've been coming into the hospital and then discharging them to skilled nursing facility. Never had any real work history, things of that nature. So its disability has to come into play with that. But the younger population, just like I said, the dementia is hitting us young.
Young, how
young. The youngest.
What age
The
group?
youngest I've seen was a 50-year-old. This guy actually was married and had a spouse, but as young as 50, I've seen with the dementia, and the onset was very high. So
that's scary.
That is very, very scary, and it's a lot more in these skilled nursing facilities. You have no idea the rise of it.
So do you think it's more from alcohol and drug abuse? It's more genetic? I mean...
It's been a lot with alcohol and drug abuse. Those prior folks have had that particular as a diagnosis or suffered with it in the past. It increases the rate of being having dementia.
You know, I read a book because I like to read, and one of the things that it said is our environment has changed, what we eat has changed, and that's probably why we're seeing early onset of dementia. Yes. What do you think about that?
I think that is true, and also with different medications also is linking to the dementia. It's really a really touchy situation because it's affecting like everyone. As far as, families going, it used to be, that person my mom had it years ago, but it's coming out of nowhere with individuals that there was no trace of it before, right. within their families. And they're becoming demented, at a younger age.
Wow, I never thought about that. One of the things that, we have a senior placement company and a private duty and a mobile medical, as you know. Yeah. And one of the things that happens to us quite a bit, and just happened to me yesterday, because I was on call for ElderCare Finders for a senior placement, 72-year-old living with a son who no longer wants her there. She called me looking for a place to live. I mean, I gave her information on group homes because she's fine physically. In health, she's fine. She doesn't need to go to assisted living. She doesn't need to go to nursing home. Yeah. She doesn't have a place to live, period. And that's what's happening also in our society now. So on a case like that, my question to you is, would I be able to give you this person to be able to maybe try to see if you can help? Maybe you can get more information from her that maybe I couldn't? It's according to what her health needs are, but you could definitely reach out to me. In a situation like that, I like to go more with independent living. So it gives them a little more freedom. It doesn't take too much from them at that time, because they're not at the stage of needing assisted living facility, someone overseeing every step of the way for them. So independent living is a way to go for a typical person like that. Again, it's the fees of if they can afford it. That's another thing with. Well, she can't. That's one of the reasons.
Yeah. So
that she was actually living with her son.
Yeah.
Right.
And so if she has those diagnoses that fit skilled nursing facilities, there are a lot of facilities that do accept. They call it Medicaid pending. So they come in with no payer source until they're approved for Medicaid. There are a lot of facilities that do accept that. But what she would have to do is, of course, go see her physician. There's a form, a 3008 form.
Which would you be able to help if I give you that information from now on? Because I like, we like to be resourceful here. Yes. You know me for a very long time. And Horizon Care Services is not just a private duty agency or, mobile medical and a senior placement agency. We are a full service senior services. So we want to be able to be as resourceful as we can. Exactly. Even though we're not physically helping those people.
Yeah, but you're still doing a part. And that's the thing. So a lot of times people take that out of their companies. They don't give that extra assistance that may be needed. I'm one of those ones like that because my background is that I was raised that way. You help who you can help. You help as much as you can, that you're allowed to do. But taking on, sometimes I've had a lot of cases where I didn't make a dime from. And it didn't matter. I helped.
Exactly.
That's the difference. And
well, we do that every day. All of us
absolutely.
here.
That's why I think that I've been blessed to continue to do what I'm doing, is because I know there's a need for it. And if I can help, I help.
Tell me about the crisis intervention. What do you provide there?
As far as crisis, it's just like that situation there. If she doesn't have a home to go to, there's no family for her, I will assist with all their needs for them. And that's most of the time, those are a lot of pro bono situation. But they don't have anywhere to go. There's no place for them. I'll assist them with all of their needs to get them in a place to where they're not on the streets or going back and forth to the hospitals and things of that nature, just to get them a place for their long term, where they're going to be forever.
And you know what? Another sad thing that happened yesterday. So I was in one of our skilled nursing facilities in Jupiter yesterday, and actually my client is the ED, the executive director. And when I came in, she was in crisis. She was trying to figure out where she's going to discharge this client. He lives in his truck, and his truck is parking. Is in a parking lot of the facility, and that's where he lives. And he doesn't want to go to a group home. He doesn't want to go to a nurse. He doesn't want to go anywhere, but she has to discharge him somewhere. So, my suggestion was, if that's the case, you're going to have to call Adult Protective Services, to be able to get this guy maybe a HUD community, a subsidized, state subsidized apartment or something. They have a lot of them in Palm Beach County, right?
Exactly.
That they can live in. Again, that's why I created this podcast, because we need to be able to be more resourceful to our community, right? Because I'm not just here to provide a service that people can pay for, but I'm also here to be able to provide anything and any help and resources to our local seniors.
And we're all about the community, helping the community, being part of it. This provides us with a lot of resources, and I think it's very important to do this. And I do have another question, if it's okay.
Yes.
Love the name 3 Angels. Can you tell me, how did that come about?
Now I'm a mother of 4 after, my kids are much older, but it was 3 of them for years. And that's where the name came from, 3 Angels. It was my daughters. Now I have a 4th one. But I just started a nonprofit for 4 Angels Love. But that's geared more, I'm gearing that more towards, the mental health side of things, because I've been doing pro bonos for like JFK, the Previvian part for the mental illness for years. And they call me and I help them. So they're not going back and forth into, getting Baker acted and things of that nature. A lot of times it's pretty much a medical side of things that needs to be handled as far as the medication management and things of that nature. So I went into that.
That's amazing. That's impressive. Yeah. I have to say mental health is also on the rise.
Yes.
Even with the younger community, with the younger crowd. It is something that we just had 2 podcasts on mental health and how important it is. So kudos to you for doing that.
Yes.
And the other thing that I wanted to mention is, again, we want to be as resourceful as we can to our community. And I wanted you to talk a little bit about the veterans.
The veterans is another part of what we dip into. I have a guy that typically he runs that program. His name is Kirk. He's an ex-veteran, but those services are major. A lot of the veterans don't know exactly what they're entitled to. That's one of the things. There's home care services that they're entitled to without having to be serving the wartime. It's just the medical piece to the veterans that they offer these services. I've ran into a lot of veterans that don't know they even have that part of them being in service for for our country. So that's one of the areas that is kind of grayed out, because a lot of the veterans don't want to take advantage of the benefits either. That's some of the things you come into. They think that someone else deserve it over them. Mm-hmm. So, which is a good way of thinking, but they do need the services. There's benefits out there for them. There's monies out there for them for their care, to help with their care throughout their years, their life.
Do you work, you said pro bono, do you work with the legal system, any attorneys or anything?
Yes, my attorney that I work with is Philip Harris. He does all of my legal things that my clients may need. If they're over income, he does the qualified income trust for them. And if they have to protect the assets, he does those type of documents for me. We are flat fee service, so we kind of combine everything together, but it makes it cheaper. I'm very, very funny about pricing. He works well with me. He's inexpensive. He's not expensive at all. He does exactly what's needed for the client.
That is wonderful.
Yes.
You do a lot.
Yeah.
You do more than 3 angels.
I know.
Really?
Which is really amazing.
Yes.
That's why I really want people to, everything for us is about preventive.
Yes.
It's education and preventive. Do it before it happened. My grandmom always used to say, be always ahead of the game.
Exactly.
Because then you want to, at the end of the day, you want to be the winner. So I always say to everybody, as much as you can learn, and I know that a lot of you that are listening to our podcast are not Floridian or from other parts of the country, find out with your local chapter or your county or your state, what kind of senior benefits do you have, for low income seniors.
Yes.
Because this is what the show is about talking about you didn't get a chance to plan for long-term care.
Exactly.
You did not save for long-term care. You did not do your investments for long-term care. What can your state or your county provides to your mom or dad or you if you ever become in need? Find out with your local state. Call the senior service in your local state. Google any Medicaid, Medicare, resource information. Be more educated in what the long-term care services provided in your state is very important. And don't wait to the last minute. Have the children like you or me, have we talked to our parents about long-term care?
Oh, yes. That's really good because my parents think they're not old at all. So it's hard.
Nobody
does. It's to the point where, it's the point that they know what I do. So it's like, okay, you have to talk about this. I've gotten as far as the life insurance and things of that nature, but getting to that advanced directives, because my parents are younger parents. They had me young, but just getting to that part, they really, it's hard with them to give up. They think they're giving up something. When you get into the advanced directives, you're only giving them this access to you, authority to you once you're in a stage.
Becoming incapacitated.
Yes, when you're incapacitated. That's it. But from the beginning, a lot of people think that the kids are going to go out and take this and move this and do this, so they don't want to go as far as getting to that level with their children. But it's very, very important. Like even with mine, after my last birth, I have health issues myself. So Philip is on board with all of my trust and everything of that nature because I have younger kids. You have to plan ahead of time, regardless of how it may make you feel in a way. You just really have to do it earlier. I sit down with your kids, let them know exactly where all of your documents are, where this, what banks, what everything that you have in place already. Let them know that, because what I find a lot of times with my clients is that kids are scrounging around through paperwork to find out exactly what mom or dad has.
And that's not fair if you think about it.
It's really not fair to them. It's stressful because just meeting with a person like myself, you're giving you have to give up all the financial information to get the Medicaid and long-term care status for Florida. But those kids have no clue what mom or dad has. Like we just said, it's not fair to them.
It's not fair to them, but sometimes it's a control issue.
Yes.
We don't want to give away control.
Yes.
But in the long run, it's our generation, I have to say.
Yes.
Because a new generation will have no problem on sending you a text with all the information. Yes. But it's our generation. We don't like to give out control, but it's a must. I agree with you 100%. Really admire everything that you are doing. You're a great resource for everyone. The company is Angels, which is 3 Angels, which is amazing.
Yes.
And a lot of people now have everything on their phones and their computers, and everything's password. So if you don't have the password for the computer or the phone, then you lose it all.
Yes.
You don't know where to start. Yeah. So it makes it very difficult. So that is very important for for everyone to be able to have their loved one, especially, either you're single, you just got out of college, now you're getting married, you're having family. Especially when you're getting married, that is the most important thing, because then your spouse automatically is going to be the person who's going to make a decision for you.
Exactly.
Is that what you want? Do you want mom and dad? Do you want your sister? Do you want your brother? Do you want your best friend? Do you want your attorney?
Yes.
Who do you want? Because as you're married, it's your husband or it's your wife that's going to make that decision for you. And you have to think about it. So put some thoughts into that, everybody. Thank you so much for joining us today for another episode of Senior Care Made Simple podcast. Sharonda's information will be down on the show notes if any of you are interested in reaching out to her for any questions, any resources that you may need. If any of you want us to talk about something that you are interested in listening to or learning, please email us at seniorcaremadesimple@gmail.com. seniorcaremadesimple@gmail.com. Thank you, Sharonda. Thank you, Doris.
Thank you for our listeners. Thank you for coming, Sharonda.
Thank you so much.
And thanks again. I'll see you next time, everybody.
Senior Care Made Simple, an ElderCare podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.